we manage our forests for external interests, and food is a tertiary interest and basically managed for as a recreational issue. So there's that. There's the cost of sort of flying in and selling food, but that's not the whole story. So we see efforts like the Fort Albany Farmers Market, where people are bringing in fresh market-based food at cost and demonstrating that it's not really the shipping that's the issue, it's the profiteering from corporations. So it's a function of capitalist economics, as well as that these are corporations that are meant to maximize profit for their shareholders. If they don't, there are implications for that. So the expectation that they'll meet our nutritional needs at an affordable rate is inappropriate to begin with. I mean, what has worked and does work is supporting household food sovereignty. So this is the concept that households can participate in any aspect of the food system that they want, right? So we look at production, distribution, sale, waste, and that sort of regenerative cycle. So this is what worked before, and this is what is working now. This is our area of focus is essentially on how we support those households and communities to do that work. So much of the granting that exists is for marketable products or agricultural innovation, and there's very little support for the household that wants to increase their capacity to prepare food or to catch food, like hunting supports, or grow their own food, or to process and cook it. So that's an area that there is a gap, and an area of focus for our research and development activities.
An interesting innovation, which I was really excited to be able to actually chair the session at a national conference that NOSM staff was my first introduction to NOSM staff, who were leading a new curricular innovation. It's called the Culinary Lab. And Lee Rysdale is here because, it's one of the ways that, in fact, the determinants of health, which is accessible, safe food supply, and the cultural competencies that you need to look at that kind of food supply, would be well taught in many of the medical schools. So, Lee, welcome. Tell me a little bit about the culinary labs.
Sure. We're piloting labs with our first and second year medical students. And so for each of their modules, we have a corresponding lab. So if it's on cardiovascular disease, then the lab corresponds with learning objectives and a menu that follows along that topic. We generally have a case that they're familiar with. They come and prepare the food. They have recipes to follow. They learn food literacy skills, including knife skills, food safety. We've had students that have told us they don't know how to grocery shop or fry meat. So they are learning skills that hopefully when they're meeting with their patients, that they'll actually be able to ask them questions related to diet and nutrition, not only to help them in terms of their assessment, but also in terms of helping in terms of care plans, as well as referrals to registered dietitians.